What's up, you guys? The Nomothete here. I'm passionate about giving you the facts about mental health, and today we're tackling a topic that I deal with personally: schizoaffective disorder and schizophrenia. These conditions can be confusing, and unfortunately, there's a lot of misinformation out there. We're going to clear up the confusion and separate fact from fiction, busting some common myths along the way. Whether you're personally affected by these conditions or just want to learn more, understanding the truth is crucial for supporting those who are and ending the stigma surrounding mental health. So let's get started. All right, first up, let's clear the air on a big one. Schizoaffective disorder and schizophrenia are not the same thing. While they share some similarities in symptoms, like hallucinations and delusions, schizoaffective disorder is its own distinct diagnosis. Think of it this way: schizophrenia is like a house, and schizoaffective disorder is like that same house, but with an added room. That extra room represents a significant difference: the presence of mood episodes, like mania or major depression, that are prominent features of the illness. In schizophrenia, these mood episodes might happen occasionally, but in schizoaffective disorder, they're a core part of the diagnosis, significantly impacting a person's life. So, remember, while both conditions involve challenges with thinking, feeling, and behavior, schizoaffective disorder adds the complexity of significant mood swings into the mix. It's crucial to recognize this distinction for proper diagnosis and treatment. Here's another myth we need to bust. There's a common misconception that schizoaffective disorder is a one-size-fits-all diagnosis. In reality, there are two main types: bipolar type and depressive type. The bipolar type involves periods of both mania and depression. The depressive type involves only major depressive episodes alongside psychotic symptoms. Understanding these types is key to providing effective support and care. Okay, let's bust another myth wide open. You might have heard that schizoaffective disorder is always caused by some past trauma. While trauma can increase the risk, it's not the only factor. Mental health is complex, like physical health. There's no single cause for schizoaffective disorder. Genetics and brain chemistry also play roles. Imbalances in brain chemicals are involved. Stress can contribute too. So trauma is a factor, but not the only cause. It's often a combination of factors. Reach out to a mental health professional for help. Remember, you're not alone in this. This next myth is one I hear all too often, and it's simply not true. Schizoaffective disorder is absolutely treatable. The right treatment plan can make a world of difference. Medication is one of the most effective treatments. Antipsychotics manage symptoms like hallucinations and delusions, while mood stabilizers regulate mood swings. Therapy is another crucial aspect of treatment. CBT teaches coping mechanisms and improves daily functioning. Don't let this myth discourage you from seeking help. With the right treatment plan, you can live a full and meaningful life. Let's clear up some confusion. Schizophrenia and dissociative identity disorder, or DID, are often confused. They are distinct conditions with different symptoms. Schizophrenia affects thinking, feeling, and behavior. Key symptoms include hallucinations and delusions. DID involves two or more distinct identities within one person. These identities have unique memories and behaviors. It's like comparing apples and oranges. All right, let's talk about a serious misconception: the idea that people with schizophrenia are inherently violent or dangerous. This is simply not true. The vast majority of individuals with schizophrenia are not violent and are, in fact, more likely to be victims of violence themselves. It's crucial to remember that mental illness does not equate to violence. Schizophrenia can manifest in ways that might make someone seem withdrawn or detached from reality, but this does not mean they're going to lash out. Just like anyone else, their behavior is influenced by a complex interplay of factors, not just their diagnosis. Treatment plays a significant role in reducing any potential for aggression. Antipsychotic medications help manage the symptoms of schizophrenia, including agitation and paranoia, which can sometimes contribute to aggressive behavior. Remember, judging an entire group of people based on a stereotype is not only unfair but also perpetuates harmful stigma. Instead, let's focus on understanding, compassion, and supporting those with schizophrenia to live safe and fulfilling lives. Let's set the record straight. Bad parenting does not cause schizophrenia. This is a harmful myth that places blame on families and adds unnecessary guilt to an already challenging situation. Schizophrenia is a complex mental illness with multiple contributing factors, and attributing it solely to parenting is a gross oversimplification. Research has repeatedly shown that genetics, brain chemistry, and environmental factors play a significant role in the development of schizophrenia. While a supportive family environment is beneficial for anyone, it cannot prevent or cause this complex disorder. Think of it this way: just like you wouldn't blame a parent for their child developing diabetes, you can't blame them for schizophrenia. Both are serious conditions influenced by a combination of genetic predisposition and other factors beyond a parent's control. It's time to shift the conversation away from blame and towards understanding the real causes of schizophrenia, so we can better support individuals and families affected by this condition. Here's another myth we need to bust. If one of your parents has schizophrenia, it doesn't automatically mean you'll develop it too. While genetics do play a role in increasing the risk, it's not a guaranteed inheritance like some physical traits. Many people with a parent who has schizophrenia never develop the condition themselves. Think of it like this: having a parent with blue eyes increases your chances of having blue eyes, but it doesn't guarantee it. Similarly, inheriting genes associated with schizophrenia increases your susceptibility, but it's not the only determining factor. Environmental factors also come into play. Things like exposure to viruses, severe stress, and drug use during adolescence can all influence whether someone with a genetic predisposition develops schizophrenia. It's important to remember that genes are not destiny. They provide a blueprint, but environmental factors and lifestyle choices also shape the final outcome. All right, let's tackle this harmful myth head on. Having schizophrenia does not equate to a lack of intelligence. In fact, there have been many brilliant minds throughout history who have lived with schizophrenia, contributing significantly to their fields. Schizophrenia affects a person's brain chemistry and how they process information, but it doesn't diminish their innate intelligence. Just like anyone else, individuals with schizophrenia have their own unique strengths, talents, and intellectual abilities. It's crucial to remember that mental illness does not discriminate. Anyone can be affected, regardless of their IQ or academic achievements. Let's challenge the stigma surrounding mental illness and recognize the inherent worth and potential in every individual. Remember, judging someone's intelligence based on a diagnosis is not only inaccurate, but also incredibly unfair and demeaning. This is another misconception that perpetuates a harmful stereotype. While hospitalization might be necessary during acute phases of the illness, it's definitely not a permanent solution or a life sentence. The goal of treatment is to help individuals with schizophrenia manage their symptoms effectively and live fulfilling lives within their communities. With the right support system, including therapy, medication, and social support, many people with schizophrenia can live independently or in supportive housing settings. It's important to remember that everyone's journey with schizophrenia is unique. Some individuals may require short-term hospital stays during times of crisis, while others may never need hospitalization at all. The key takeaway here is that a diagnosis of schizophrenia doesn't define a person's entire life. With proper treatment and support, individuals with schizophrenia can thrive in their communities and achieve their goals. Let's debunk this myth right now. Having schizophrenia doesn't automatically disqualify someone from having a successful career. While the illness can present challenges in the workplace, with the right support and accommodations, many individuals with schizophrenia can and do maintain meaningful employment. The key is to find a work environment that understands their needs and is willing to provide the necessary support. This might include flexible work hours, a supportive supervisor, or adjustments to the work environment to minimize stress. There are also fantastic organizations dedicated to helping individuals with mental health conditions, including schizophrenia, find and maintain employment. They offer job training, resume building, and interview skills workshops to empower individuals to succeed in the workforce. Remember, everyone deserves the opportunity to contribute to society and experience the sense of purpose and accomplishment that comes with a job well done. Let's support those with schizophrenia in their pursuit of meaningful employment. Alright guys, let's tackle another myth about schizophrenia head on. The idea that people with schizophrenia are lazy really gets under my skin. Imagine waking up and your brain is playing tricks on you. You might hear voices, see things that aren't there, or feel like someone's controlling your thoughts. Even simple tasks feel incredibly difficult. It's not laziness, it's a complex mental illness affecting thoughts, emotions, and behaviors. Let's ditch harmful stereotypes and approach mental health with empathy and understanding. Now let's address the myth that schizophrenia always appears out of the blue with a sudden dramatic psychotic break. While some individuals may experience a rapid onset of severe symptoms, this isn't the case for everyone. Schizophrenia often develops gradually, with subtle changes in behavior, thinking, and mood occurring over time. These early signs can be easily missed or dismissed as something else, especially in younger individuals. Early symptoms might include withdrawal from social activities, difficulty concentrating, changes in sleep patterns, and unusual thoughts or beliefs. These early warning signs are crucial to recognize because early intervention and treatment can significantly improve outcomes. Remember, schizophrenia is complex and its presentation varies from person to person. Don't assume that a sudden psychotic break is the only way it manifests. If you or someone you know is experiencing concerning changes in their mental health, seeking professional help is essential. This is perhaps the most harmful myth of all, that schizophrenia is a life sentence with no hope for recovery or a fulfilling life. This couldn't be further from the truth. While it's true that there's no cure for schizophrenia, it's absolutely treatable. Treatment for schizophrenia is highly individualized and typically involves a combination of approaches, including medication and therapy. Antipsychotic medications can help manage symptoms like hallucinations and delusions, while therapy can provide coping mechanisms, improve social skills, and address the emotional and social challenges that come with the condition. With proper treatment and support, many individuals with schizophrenia can experience significant improvements in their symptoms and overall quality of life. They can lead fulfilling lives, pursue their goals, and maintain meaningful relationships. Remember, schizophrenia is a chronic condition, but it doesn't define a person's worth or potential. With the right treatment, support, and self-care, individuals with schizophrenia can thrive. That wraps up our myth-busting journey into the often misunderstood world of schizoaffective disorder and schizophrenia. Hopefully, this video has shed some light on these complex mental health conditions and dispelled some of the harmful stereotypes that surround them. Thanks for watching. If you found this video helpful, please like, share, and subscribe for more content on mental health. Remember, understanding and compassion can make a big difference. Pause. Tens. Well, that wraps up this video. If you made it this far, I want to say thank you. I'm glad you spent your time with me learning about the myths of these debilitating disorders. The more knowledge we have on the topic, the better we can treat people who suffer from them. Just because we have a mental illness doesn't mean we can't live normal lives. Don't forget to like, share, comment, and subscribe, as it really does help the channel. Also, if you have ideas for an episode, please let me know. I love hearing from you guys. Once again, thank you for spending your time with me. You guys take care, and always remember to question your reality.